siamo a Madrid, dove è in corso il congresso annuale dell'ESMO, la Società Europea di Oncologia Medica. Al congresso sono state presentate diverse novità sulla cura di tumori ginecologici e su nuove terapie promettenti in sviluppo per la cura di queste neoplasie. Fra queste vi sono i risultati preliminari ma molto interessanti di uno studio nel quale si è sperimentata nel tumore dell'ovaio avanzato una combinazione di due farmaci, un farmaco nuovo sperimentale che si chiama ubamatamab e l'anti-PD1 cemiplimab, che è già approvato ma non per il trattamento del carcinoma ovarico. Noi ci facciamo raccontare i risultati di questo studio dall'autrice che li ha presentati, la professoressa Roisin O Cearbhaill. Dr. O'Carroll, in your study you decided to test the combination of an investigational drug that is ubamatamab and an already approved anti-PD1 antibody that is cemiplimab in patients with recurrent ovarian cancer. But first of all, which kind of drug is ubamatamab and which is its mechanism of action?
Ubamatamab is a bispecific antibody, and it's a novel agent. If this was a first-in-human study, and so what we did was investigate a bispecific that brings together the CD3 portion of the T cells with a target surface antigen called MUC16 that's expressed on the surface of ovarian cancer cells. And the idea by bringing these two together is that this would elicit cell death, and that's in fact what we did see. And the rationale for this study was to add in checkpoint blockade to make the treatment even more efficacious.
But which is the rationale of combining ubamatamab, this new drug, with cemiplimab?
Well, we've already had some preliminary data looking at ubamatamab as a monotherapy, and there was a strong rationale for trying to combine checkpoint blockade. We saw this in our preclinical work, and then in fact in this our own study that we conducted, we did in fact see some patients who had progression of disease on monotherapy were subsequently able to derive a response when the addition of cemiplimab to the combination therapy.
Could you explain us which is the design of your study, the study you presented here at ESMO?
Yes, it's a phase 1-2 study, and we're presenting the cohort of patients who received ubamatamab in combination with cemiplimab. We looked at different dose levels ranging from 1 milligrams to 450 milligrams, and we combined them with cemiplimab that was given starting between days 29 and 36. The cemiplimab was given intravenously once every 3 weeks, and then we looked at dose-limiting toxicity up until 21 days after the addition of the cemiplimab. It was for patients with recurrent ovarian cancer who had an elevated CA125 and who had received prior platinum-based therapy.
Which results did you obtain so far in this study? And is the study still ongoing?
Yes, the study is still ongoing. However, the great news is that we do have a phase 2 expansion. And so in terms of the results, we did see that some patients derived a very substantial benefit. The main aim of this study was primarily safety. So we continued with our dose escalation, and we eventually decided on a dose of 250 milligrams to move forward for the dose expansion. However, we did investigate doses up to 450 milligrams. The only 35 patients were treated, and the only dose-limiting toxicities we saw was one patient treated at the 60 milligram dose had a grade 4 neutropenia lasting 7 days, and another patient treated at the 450 milligram dose had HLH, mast activating syndrome. So in totality, based on all the information that we had, we elected to proceed with the 250 milligram dose in combination with cemiplimab for the phase 2 dose expansion.
And did you analyze also some preliminary results about efficacy of this combination?
Yes, we did. We saw some very great durable responses. Approximately 18% of patients had an objective response. However, almost half of the patients at 6 months were progression-free, and 23% of the patients at a year did not have progression of their disease, which is really remarkable in this patient population. So very exciting preliminary work. And as I mentioned, we did see some patients who had progressed on monotherapy subsequently derive benefit and in fact go on and have a durable benefit when cemiplimab was added in.
Based on these results, what will be the future development of the combination between ubamatamab and cemiplimab in ovarian cancer?
Yeah, so we have an ongoing dose expansion that's 3 arms. There's 2 looking at different doses of ubamatamab as monotherapy, and then we have a single arm looking at the combination of cemiplimab with ubamatamab at a dose of 250 milligrams, and that is ongoing and actually enrolling very well. So we hope to have the results of that portion of the study in the very near future.